Good morning everyone, hope you are all safe at your homes. This is a short tutorial about the operating theater settings and principles. In this tutorial we will discuss three main topics. The first topic is about the theory behind the operating theater design and the principle of disinfection and sterilization. Then we will have a tour inside the operating theater of our department of OBGYN in Al-Qasr Al-Aini. And finally we will show you how to put on your sterile gloves and gowns. Before we discuss the theory behind the operating theater design, we have to discuss the basic and the magnificent role played by our skin in our innate immunity. This skin is covered from outside by all kinds of pathogens, and it acts as a very efficient barrier, preventing any pathogen or any microorganism from passing through, keeping our internal environment a completely sterile condition. Unfortunately, in the operating theater, we have to breach this barrier. We have to cut through our patients to do surgery. So we make our patients vulnerable to all kinds of microorganisms to have an access to the inside of their bodies. So it's our duty to save our patients from all kinds of pathogens and to perform our surgeries in a completely aseptic conditions. In order to do this, we have to get sure that anything that comes in contact with our patients in the OR is completely sterile. This is easy to do with surgical tools and equipments, but it's not that easy with surgeons. We cannot sterilize human body, so we have to make a stepwise procedure to decrease the pathogenic load on our bodies before we go to the OR. Then we have to cover our whole bodies with sterile clothes in order to ensure asepsis. This is a simplified design of the operative theater zones. Hello again, this is our tour in the OR. Now we are in the unrestricted area in this area. People walk from this door with their ordinary clothes. They have to pass through this station to wear then overshoes covering their footwear. Then they go to the transitional zone. In this transitional zone, they change their ordinary clothes with clean clothes. This is the transitional zone or the semi-restricted zone in the OR, where doctors change their clothes and wear clean scrubs and footwear. We are not allowed to pass this door to the clean zone except after we wear clean scrubs and footwear. First, we want to thank Dr. Mohamed for his volunteering to perform scrapping in front of us. First, he will wear his personal protective equipment. He will put his overhead. And his surgical mask. Additional personal protective equipment, including face shield, should also be worn. Now Dr. Mohamed will perform his hygienic hand disinfection in the famous 6 steps. He rubs his hands palm to palm and dorsum to dorsum, the tips of the fingers in a circulatory movement, then the back of his fingers against each other. Then he rubs his thumb, both hands, the rest of both hands, and the rest of the forearm. He washes his hands in a manner that keeps the tips of his fingers always upward, and he repeats this procedure 3 times. Now Dr. Mohamed will show us how to wear the sterile gown. He catches his sterile gown from the inner side without touching the outer side. He gets inside the gown without readjustment, and he keeps his hands up. That's his position. An assistant comes to tie the back of the gown. Now Dr. Mohamed will show us how to put sterile gloves on with the non-touch technique. He starts with his right hand, only touching the inner surface of the glove. Then he goes to the left side, touching the sterile surface with the gloved right hand, and he put his left side too. Now he can readjust the gloves